Okay, we'll start agada tantra, second class. So the last class we discussed about agada tantra, and I have given the introduction also, and different names given in other samhitas for agada. For example, in Charaka Samhita, it is called as Vishagara Vairodhika Prashamini. Okay, the name agada tantra used in Charaka Samhita is Vishagara Vairodhika Prashamini. Okay, so like that in Sushruta, it is agada tantra only. In Vagbata, both Ashtanga Sangraha and Ashtanga Hridaya, it is Damshta. Okay, the name is important. In Charaka Samhita, Charaka Sutra, 30th chapter, they are taken. It's one of the Ashtangas of Ayurveda. They call it as Vishagara Vairodhika Prashamini. Okay, so in Ashtanga Sangraha first chapter, Ashtanga Hridaya first chapter, it's called as Damshta. Okay, so what is the meaning of Visha here? Visha that will generate Vishada in the body is called as Visha. The word meaning of Visha is to bring Vishada in the body. So Visha that will bring Vishada in the body is called as Visha. That it brings Vishada in the body is called as Visha. So agada, already I told you. So antidote. So the action taken against the gada. Agada. Okay, against the gada, whatever action we will take, it is called as agada. So in English translation, we can call it as antidote. So agada we can call it as antidote. Or else, so what are all the pratikriya we are given to mitigate visha in general? Okay, so it's called as agada. So description in Samhita, the references. So entire Sushruta Kalpasthana is dedicated to agada tantra. Okay, Charaka Chikitsa, 23rd chapter is dedicated to agada tantra. So Ashtanga Hridaya, Uttara Tantra, 35th chapter to 38th chapter. Ashtanga Sangraha, 40th chapter to 48th chapter. Okay, in Charaka Samhita, one chapter is dedicated to agada tantra. So other samhitas related to agada tantra, even we have a reference in Kashyap Samhita, and one of the oldest book of agada tantra is Alambayana Samhita. So the reference of Alambayana Samhita, we will get it in Dalana commentary of Sushruta. There he has taken the reference of agada tantra, Alambayana Samhita. Ushana Samhita, Shaunaka Samhita, Bruhaspati Samhita, Kautilya Arthashastra. Okay, these are all the granthas, ancient granthas related to agada tantra. Okay, Kashyapa Samhitadalli ಕೆಲವೊಂದು references ಇದೆ. Available ಇರ್ತಕ್ಕಂಥ ಚಾಪ್ಟರ್ಸ್ ತುಂಬಾ ಕಡಿಮೆ. ಕಾಶ್ಯಪ ಸಂಹಿತದಲ್ಲಿ 78 chapters only available out of 200. So and then Alambayana Samhita. 1 minute. Alambayana Samhita is one of the oldest toxicological textbook available. And the same reference is taken in Dalana commentary of Srishti Samhita. And some references will be available in Ushana Samhita, Shaunaka Samhita, Bruhaspati Samhita. And even Kautilya is almost after Charaka Samhita, almost contemporary to Charaka Samhita, Ashoka Kala. So during that period also, he is only started about Vishakanya concept. So how to kill enemies without fighting them. Even they will mix Visha in everything, even in the food grains, and even in the pond, even in the air, even in the slippers. Okay, so even in the dresses. Okay, so how to kill a person? So there are more n number of techniques to kill a person by using Visha. So during that period, so everything will be checked before giving to the king. Even the water, juices, everything will be monitored and everything will be checked before giving to the king. So if you've seen the Ashoka serials or movie, you will get to know about it. And before that, even a human tasting is one area. And even these food items will be given to the animals to check, recheck again. Okay, if animals consume that so and so visha, they will be reacted in different way. So, chakora pakshi, what it will do. So, if it is given to the monkeys, how they will react. And even if you throw visha to the fire, so the different colors will come. So, in all the way, they will check the poisoning in food and in everywhere. Then only they will give it to the king. In war science, this Vishakanya concept was a huge victory during that time. So they will grow Vishakanyas and they will marry to some other kings, enemy kings, to kill them. And how to identify that Vishakanya, all these features will be available. So in Sushruta, Ashtanga, Hridaya, Ashtanga, Sangra, it's available. Features of Vishakanya. Even the flowers with the smell, with the respiration of Vishakanya, the flowers will come down. Okay, ಏನಂತೀವಿ ಮಾಸ್ತೆ ಅಂತೀವಲ್ಲ, and the color of the flowers will change, get changes by just the respiration, the smell of Vishakanya, it will going to change. So all these things are given in Kautilya Artha Shastra. Same thing he also copied in Ashtanga Sangra, Ashtanga Hridaya. Okay, Anna Raksha Vidyadhyaya is the same chapter available in Ashtanga Sangra and Ashtanga Hridaya. But in Sushruta Samhita, Kalpasthana, first chapter is Anna Raksha Kalpa Adhyaya. The first chapter of Sushruta Kalpasthana is Anna Raksha Kalpadhyaya. Anna Raksha Vidyadhyaya is in Ashtanga Sangraha, 13th chapter. Maybe not 13th, 6th or 7th chapter. Ashtanga Sangraha Sutra 13th is Agre Sangrahani Adhyaya. Okay. So these references, these are all the classical references of Agatantra in our books, other granthas related to Ayurveda. Synonyms of Visha, this you should note down. Shveda, Garala, Kalakuta, Shveda, Garala, Kalakuta. Okay. So next comes classification of Visha. So mainly Vishas are classified into Stavara and Jangama. Again, Stavara is classified into Krutrima and Akrutrima. Garavisha will come under Krutrima Visha. Garavisha will come under Krutrima Visha. So Stavara Visha is plant origin, Jangama Visha is animal origin. So some other classified Visha again, three types, Stavara, Jangama and Krutrima. So main classification is Stavara and Jangama. So and then Stavara and Jangama and Krutrima is also one of the classification. So Kritrima Visha here it refers to Samyogaja Visha. It's also called as Gara. In Bhava Prakasha, so they added Dushi Visha is also a type of Visha. Bhava Prakasha. Dushi Visha is also a type of Visha. So Garavisha, you can call it as a Samyoga Javisha. Okay. So Garavisha is Samyoga Javisha, mixing of two non-poisonous things or two poisonous things, both. Okay. So for example, for Garavisha is equal quantity of Ani and Gurta. So individually, both Madhu and Gurta is non-poisonous. If you mix it equal quantity, then it will becomes a poison. Then it becomes a Garavisha. So Garavisha is one of the cause for present illnesses, whether it may be issue of cancer, whether it may be an issue of autoimmune diseases, whether it may be an issue for infertility. So in village side, they are telling infertility is because of using excess of chemicals or chemical generated fruits. Okay, one plant is there. If they use that plant with the steel vessels, the kashaya of the plant with steel vessels, then it becomes a poison. So like that, we don't know how the gara will enter into the body. So present day, whatever the food items we are using, completely an hybrid varieties. So genetically modified. So it may be a wheat, it may be a ragi, it may be a barley, it may be a rice. So and almost all vegetables, these are all genetically modified. And even the milk what we are using today is a genetically modified A2 milk we are using, A1 milk we are using. It's completely genetically modified. Okay. So these genetic modification will lead to some other complications. So it may act as a gara, or else it will lead to some other complications in the body. Okay, so a lot of immune responses will be mitigated by consuming these types of gara. Yeah, but still, how and when cancer will develop, we don't know. So for cervical cancer, they are identifying HPV virus, human papilloma virus is a cause for cervical cancer. That is the one thing. And for lung cancer, we have identified because of chemical damage, because of tobacco. Oral cancer, again, chewing of tobacco. Except these three types of cancer, and some hepatic cancers is because of viruses. So hepatitis B, C, D, and E viruses. Except these three areas, other cancers we don't know. What is the cause for cancer? So 3 days back, I got a report. Is only a 3 years old baby. She has a macular degeneration and some small cyst in the eye. And they advise for a MRI scan. They are giving it as a neoplastic radiology. It's a cancer in the eyes. Okay, just 3 years girl, cancer in the eye. So solution is they have to remove the entire eye. Luckily, it has not metastasis to anywhere in the body. Only it is there in the eye. So after removal, then we have to go for further studies, uh, especially how whether it is a cancer or non-cancerous. So those things will be studied after. But in primary identification with the CT and MRI, so it's found out that it is a neoplastic radiology. It's not a benign one. Okay. So this cancer is very high because of our altered food, hybrid food varieties, improper lifestyle, improper diet style. These things will lead to gara. Okay. So if you properly identified the gara, then easily we can reverse the things. So that's why our Acharya told to do Rutu Shodhana properly. So according to the Rutu, if you do the Shodhanas, these Gara Vishak and Dushi Vishas will go. It will not stay in the body for longer period. So that is the concept of Ayurveda. So the Gara Visha that will going to stimulate the doshas. Doshas again will do the Dushana to the Dhatu or Mala. So that will going to start the pathological process. How Gara will start, it will again aggravate with the doshas only. Garavishas will be a continuous stimulator for dosha. Just it's a electrical fuel like. Continuously it will going to stimulate that. Okay. So continuously it will going to modify the cell metabolism. It will irritate the cell. The one theory for cancer is it's because of irritation. Some chemical damage, some other things will go into irritate. One example I can give you regarding this Garavisha or Dushivisha, latent poison. So you know about DDT. So it's a poison. It's used to kill pets or cockroaches or other this one kitas in the home. So usually commonly we'll use it to kill ants. ಸೊ ಇರುವೆಗಳು ಗೊದ್ದಗಳು ಜಾಸ್ತಿ ಬರಬಾರ್ದು, ಕಾಕ್ರೋಚಸ್ ಜಾಸ್ತಿ ಆಗಬಾರ್ದು ಅಂತ in since 1960 the DDT was in the market. Okay, so DDT is a non-biodegradable material. You know the meaning of non-biodegradable. It won't disintegrate, it won't degrade if it is going to the soil also. Even plastic will also melt after some years. But these chemical DDT will not disintegrate in any form of soil. Okay. So what happens if you put DDT? It will be mixed up with the water, and again it will go into the soil. So if you consume the vegetables or fruits grow in the same soil, that will also contaminate it with DDT. Again, the DDT will come to the body. This is the vicious cycle, continuous running cycle. How our body will get toxins. And many areas we are using a plastic for food storage and as well as food manufacturing. We are using a lot of plastics. Even in the bakery, without plastic they won't pack anything. Even the breads, rusk, cakes, with high temperature of these food items, it definitely will interact with the plastic. Okay, again it is a chemical. So some sort of chemical, I am not telling you even one day of consumption of this plastic will go into cause so and so disease. It's a continuous pathological process. So cancer will not start in a day. So before the appearance of symptoms, it may take some minimum 5 years to 10 years. Pathogenesis has started 10 years before. When the symptoms appears, it is the end stage. It's not the first stage, it's the end stage. Okay. So by avoiding all these things, we can able to prevent cancer at least for 50 to 70%. Okay, we can able to prevent. So that in that way we can think. So even every human body contains some 80 parts per millimeter of DDT. Even my body, your body, every body will contain DDT. DDT is one such chemical. You just imagine how many pesticides, how many fertilizers used for agricultural purpose. So these are all the chemicals. Even endosulfan is the chemical used to grow grapes. Without endosulfan, grapes will not grow. Okay, they will dip entire bunch of grapes in endosulfan completely. So they are using a lot of preservatives to preserve food for longer period. A lot of pesticides. So these are all the chemicals definitely will enter into our body. Again, it will act as a doshavisha and garavisha. So how gara will generate? It's because of our mistakes. And those who are using a plastics or these pesticides, they don't know why. They don't know the effect of these things. And chemical food items, food coloring agents, artificial food items. Even the milk they are making with some chemicals, artificial milk. So artificial sweeteners, artificial juices. Again, the number will go up. From where we will get gara and dushi. So what my advice is, when you are a clinician of agada tantra, whenever the patient comes to your clinic, first and foremost thing you have to give one antidote, universal antidote. Shirisha is the best vishahara dravya. You can give Shirisha asava, Shirisha de agada, any agada, bilwa de agada, dushi vishari agada. So like that agada for 5 to 10 days. Again, immediately you can tackle the disease. Many of the skin diseases is because of this dusha or Bharavsha. Okay. So many a times these skin problems won't respond. Just to give Dushi Vishari Agada or Bilwadi Gudika, it will respond immediately. Because these two are antidotes. Durvadi Kashaya. So it's an antidote. Okay. So Rajani Adi Kashaya. Rajani means Saritra. That's an antidote. So as a clinician of Agata Tantra, so you can think in that angle. So with our fast life, fast food, everything will be fast now. So to get rid of these chemicals, first and foremost thing is should give Agada Pan. First and foremost line of treatment according to Agada Tantra clinicians is not Dipana Pachana or some other thing. We should give antidotes. So in clinical experience also very good with these drugs. So usually I keep Shirisha Agada. So allergic rhinitis, allergic bronchitis, asthma patients because of allergy. So I used to give Shirisha the Kashaya. It's a very good response. And even in skin unresponsive patients, continuous doing Omana Virachana also repetitions will be there. Those patients will give this one Agada or urticaria. So urticaria is a deadly disease for patients and even for a doctor. If they consume daily antihistamines also, it will not go, at least for a 6 months to 9 months. You know, apply any kind of oil, give any hepatic protective drugs, hepatoregenerate, hepatotoxic drugs, everything we have done, still it won't go. So during that period, the Shirisha Dagada or Shirishadi Kashaya will do well. Bilvadi Gutika, Dushivishadi Gutika, Patala Kotakronya Kashaya. So it's a hepatic rejuvenator and detoxifier. Patala. Patala Kotakrovini. So these drugs we can use as in case of agada practice. Okay, so in Kerala this practice is very much and they will give you some fresh kashayas everywhere. You can visit any hospitals in Kerala. It may be an eye hospital in Shividariyan or Manasarovar hospital in Kottakal. Manasarovar 300 bed hospital will be there in Kottakal, 100 bed hospital and 300 general hospital will be there in Kottakal, in Trivandrum hospitals, wherever you go in Kerala, if it may be a resort, whatever it may be, you will get a fresh kashayas everywhere. Okay. So Dara or Aridra, so they are estimable. So Trifala, they will use some detoxifiers only. Natural antioxidants and agada drugs. They are used to give as a kashaya. You will get a very fresh feel after taking those kashayas. So those concepts also you can adapt in your clinics. Whenever the patient comes to your clinic, you can give green teas in the form of agada. Agada, you make a green tea and give it to the patient. So the freshness will be there. After that, you give Shirisha Agada along with some Virechaka drugs, Samsana, Anulomaka drugs, Aritaki based drugs or Senna based drugs. So patient will get some sort of relief by taking this. So people will complain about Ayurveda will not work fast, but we can do wonders by these medicines. Okay, so you can utilize Agada Tantra in your regular clinical practice. Anything and everything is possible if you think like that. It's left to the creativity of a physician. How we can take, how we can handle it. It all depends on the yukti of a physician. Acharya not told how to practice. He is just explained these are all the symptoms, this is the disease. This is the disease pathology. How to apply the disease to the patient is left to the physician. If fever comes, if you recite a shloka of fever won't go. Right? Jara bantunda jara shloka ಹೇಳಿದ್ರೆ ಜ್ವರ ಹೋಗುತ್ತಾ? We have to give the medicines. We have to find out the stage of a disease. We have to give the medicines. Okay. So that's left to the act of physician. That's called as yukti. Aushadha Yojana, Chikitsa Yojana. So diagnosis, the stage of disease, everything is depends on the physician. Got it? So this is the classification of visions. We'll just go through it. According to Rasavagbata Rasna Samuchaya, Vishas and Upavishas, there are 8 main Vishas and Upavishas are 11 in number. These notes I will forward you. So Visha is Mahavishas or Visha main Vishas are 8 in number. Upavishas are 11 in number. This is a classification according to Rasaratna Samuchaya written by Rasavagbata. And most important question mm, in Agada is classification of Visha Gunas. Total number of Visha Gunas. So 10 according to Charaka Samhita, Ashtanga Hridaya 11, Ashtanga Sangraha 11, Sushtu Samhita 10. तीक्ष्ण उष्ण रुक्ष विशद व्यवायी आशकारी लघु विकासी सूक्ष्म अव्युक्त रस. Okay, and anirdish rasa is according to Charaka avyukta rasa. Once again, you will go through this Visha classification. I will come in 2 minutes. Just go through the option of each Vishaguna. I will be back in 5 minutes. So rasa and its action. What Tikshna will do? What Ushna will do? That is a second level question. Tikshna. So that is the homework. You just go and do it. You have to memorize. What is the action of Tikshna in the body? Huh? Marmatla. Right. So what is the action of Ushna? Visha spreads faster. So like that, all gunas having one action. You just go through it. Because every Visha guna has its own action. Visha guna almost equal to Madhya and opposite to that of Ojas. Madhya is also having 10 guna, Ojas is also having 10 guna. So you make a comparative chart. Visha, Madhya, Oja. All three you make a chart and you can compare in a single chart. That is your homework. So do it today only. Then Visha Adhisthana. Tavari Visha Adhisthana is 10. Jangam Visha Adhisthana is 16. So 55 Stavara Vishas are mentioned in Sister Samhita and 21 Stavara Vishas are mentioned by Charaka. Okay. Almost Stavara Vishas of Charaka Samhita is a Mula Visha. Okay. Stavara Visha Adhisthana are 10. Jangam Visha Adhisthana are 16. Stavara Visha Sankhya Sushtuta 55. Acharya Charaka 21. So the effects and symptoms of Stavara Visha, Jangam Visha and Dushi Visha. This is very important question. So usually question will come like that. So Pipasa, Murcha, Vamana are the symptoms of Stavara Visha, Jangam Visha, Dushi Visha. Like that I will ask that question or all of this. So this is the effect of Dushi Visha. Okay, so all the symptoms you need to memorize. Nidra, Tandra, Klama, Daha, Apaka, Loma, Arsha, Shofa and Atisara are the symptoms of Jangama. Jura, Ikka, Danta, Arsha, Galagraha, Fena, Vamana, Aruchi, Shwasa and Murcha are the symptoms of Stavara. So Dushi Vishadalli, Binna Purisha Varana, Viganda, Pipasa, Murcha, Vamana. So these are symptoms of Dushi Visha. So Stavara, Jangama, Dushi, Muru symptoms, we go through it. And total classification of Vishas, Stavara Vishas, Mula Visha, Patra Visha, Pada Visha, Pushpa, Tvat, Sara, Niryasa, Shira, Dhatu and Kanda Visha. This is the Visha classification in Stavara. So total number of Stavara Vishas are classification. Mula Vishas are 8, Patra Vishas are 5, Phala are 12, Pushpas are 5. So Tvaksara 7, Tvaksara Niryasa, all 3 are 7, Shira 3, Dhatu Vishas are 2 in number, Kanda Vishas are 13 in number. Okay. And Mula Vishtali, Vicharal the Dravya will come in Mula Visha. So that we should go through it. And again the symptoms of each. Okay. This is a second and third level question. So regularly these questions won't come. So but you should prepare for this. Okay, second and third level questions. First level only they will ask the total number of Patra Vishas, total number of Mula Visha, total number of Nivyasa, total number of Kanda Vishas. Okay. And second level questions are Jalakshiri is an example of whether it is a Kshira Vishana, Dhatu Vishana, Kanda Vishana, Tvak Vishana. Okay, so that is the question. It is an example for Kshira Vishana. Okay, and then they will give you some symptoms, and again they will ask these symptoms are very common in which Vishana. Okay, for example, Vamana and Adam Mamsa, Vamana and Admana are the symptoms of which Visha? Pushpa Visha. Vamana and Admana are the symptoms of Pushpa Visha. So like that question may come in APGT. Okay. Just go through it. Again, same in Charaka and Sushruta classification. So most important effective in Visha is Visha Vega and as well as Visha Vega Lakshana. Lakshana and Chikits. So Dhatugata Visha and as well as Chikitsa. Okay. So in Vagbata we have 7 Vega with Lakshanas. In Charaka we have 8 Vega, including 8th Vega is Maran. Okay. So we just go through it. And it is a very important chart. We have to memorize. The whole chart you have to memorize. And effects of specific Kanda Vishas. So Kalakuta, Vatsanava, Sarshapa, Palaka, Kardamaka. So every Kanda Visha having some symptom. So every Visha with some symptom. It's all confusing. Uh, it will come in second and third level questions, not a first level questions. First level questions will be how many Kanda Vishas are there with an example. So second level is Palaka having so and so symptoms. Or Mustaka having so and so symptoms. So just go through it. If you just read it out, if you find this is special, you just mark it out and read. If you get a time, you can memorize all those things is well and good. Chikitsa for Vishavega. First Vishavega, Achara Charaka has given Vamana as a Chikitsa. Sushruta Vamana, Shitambu Sechana, Agada and Madhusarpi. Okay. So Vishavega and as well as Vishavega Chikitsa. This is for Stavara Visha. Okay, Stavara Vishavega and Jangama Vishavega both are different. In Jangama Vishavega, Acharya Sushruta has given Vishavega for all 3 sarpas. Separate Vishavega for all 3 sarpas. Seven Mahavishas are also mentioned. Just go through it. I will share you the details. And Upavishas, just go through it. Numbers. Yeah. So, drugs under Shodhana Dravya. This is a very important FAQ. And clinically also, you must remember all these things for clinical practice. So, Visha, their Shodhana Dravya, and their antidote. Okay. Vatsanava, what is the antidote for Vatsanava? Agada for Vatsanava? Tankad. So, whatever may be the preparations of Vatsanava, definitely we will find Tankada as one of the ingredient. In all the preparations of Vatsanava, we will find Tankada as one of the ingredient. Even you can just open Mrutyunjaya Rasa, there you will get Vatsanava and Tankada together. Okay. So, any formulations of Vatsanava definitely will get Tankana as one of the ingredient. It is just to control the poisonous effect of Vatsana, to nullify the poisonous effect of Vatsanava, to control Vatsanava effect. Same like wherever you use Parada, you will have a Gandhaka. Okay, Kajali. Either they will take Parada Gandhaka in separate, or Kajali, they will take Kajali is nothing but Parada Gandhaka with some other drugs. Okay, so this is a very common thing our acharyas used. So definitely whatever may be the Visha they will take as a medicine after some proper purification, still they will use as an antidote, one antidote in it. Okay, so this is the way they will make a formulations, they will make a combinations. Okay, and then what is the Shodhana Dravya for Vasanama? Godugdha or Gomutra Svedana. Godugdha or Gomutra Svedana. Aifena. Antidote for Aifena. Karpasa Tvak Churna. Karpasa Tvak Churna. Antidote for eye phaena is Karpasa Tvak Churna. How to purify eye phaena? Bhavana with Ardhaka Swarasa 21 times. Bhavana with Ardhaka Swarasa 21 times. Eye phaena. Bhavana with Ardhaka Swarasa 21 times. You know the drug eye phaena, opium poppy. It's an extract of opium poppy seeds. So how they will collect opium poppy? So just they will puncture opium poppy fruit. It's a very small fruit, and after 6 to 12 hours, some secretion will be there in the punctured area. So that is hyphen. Opium is not an hyphen. Cuscus is not an hyphen. Okay, so it's extract of cuscus. It's a narcotic drug. Addictions will be there. Okay, so usually in olden days, for preparation of good painkillers, we used to will use ifenazole or ifenazole. Just a narcotic drug we are using for preparation of anti pyretics and as well as analgesics. So it will give you very good analgesic effect. And CNS pain receptor blocker activity can be established by using ifen. So in case of Rona, Dushta Rona, or in case of sciatica, in case of tumor pain, here local acting anti-inflammatories or non-steroidal anti-inflammatory drugs won't work. So then the neurological pain will be blocked by CNS, central nervous system pain receptor block. Almost all these narcotic drugs will work on brain, not on the local area. So, for example, in modern also tramadol, you know about very common brand name Ultraset. The main content of Ultraset is tramadol. It's an extract. It's a narcotic extract. So it will work on brain. Even in cough syrups, codeine phosphate, codeine syrups. So now it is banned. Codeine is not used as a medicine now. And in some antispasmodic drugs, spasmopraxivin, you know about spasmopraxivin is an antispasmodic drug. It also contains some narcotic extracts. So these medicines will work on the brain. It will go into black CNS pain receptors. It's a very good drug of choice. So unfortunately, government has not given permission to use these medicines because patients will get addicted to it. Okay, so how this addiction will be there in the patient means, so every day the patient will come and purchase some 5 to 10 bottles of codeine syrups. He will drink and he will sleep all day. Without these medicines, he won't get sleep. Even the drug spasmopraxivin, I have seen in a medical shop, they will purchase 10 tablets, 20 tablets at a time. They will consume all 20. So before 2 years, you will get some Corex syrups, codeine phosphate, green linked codeine phosphate, Corex, all cough. So these are all the syrups contains codeine as one of the ingredient. Every 1 hour, you will consume 1 or 2 bottles of these codeine syrups continuously. Okay, so much of addiction will be there with these drugs. So government has been banned these narcotic preparations, and even for Ayurveda also we cannot use these preparations. Even ifenazole we won't get it in the market now. Ifenazole is such a drug, it will induce very good sleep. Okay, and natural painkiller. So for that reason, we will advise patient to use cuscus milk. It will induce sleep also, and it will go into block CNS cough receptors. So CNS cough receptors and as well as pain receptors, both. Tranquilizer drugs. Okay, so this is the season for dry cough. We will see many patients complain of dry cough. They won't get any sputum. This is the kapha sanchaya kala. Started with kapha sanchaya kala. Kapha will accumulate in the lungs, accumulation in the chest. So that will going to irritate for coughing. Actually, cough is not a disease. It's only a protective reflex. Okay, it's a protective reflex. Something will be there in the chest. It should come out. For that reason, only cough will come to eliminate something from the lungs. It may be a mucus, it may be a blood, or it may be any ruptured tissue. So it should come out from the lungs. So that's why the cough will come. Okay. Sometimes irritation also will give you the cough. So cough is not a disease, it's a symptom. It's a protective reflex of the body to take out some unwanted things from the lungs. You just imagine without a cough, we cannot live. So much of dust, pollution, so much of mucus will be filled in the lung cavity so that we cannot breathe it out. So cough is actually a bone to human being. It's a vara. So some persons, this cough reflex was absent. In those patients, we use coughulators, some instruments to stimulate cough from the brain. So like that persons also there without cough for their lifetime. For them, the instrument was used is called as coughulators to induce cough. Okay, this is Ifena. So Ifena antidote for Ifena is Karpasa Tvakchurna Bhavana with Ardhaka Surasa 21 times. So just imagine 21 bhavanas, not one or two bhavanas. Such a strong drug it is. Ifena is such a strong drug. Next comes Jayapala. Antidote is Yela Churuna and Dadi. Antidote for Jayapala is Yela Churuna and Dadi. Svedana in Dola Yantra, Svedana in Dola Yantra and Barjana with Gruta. Svedana in Dola Yantra and Barjana with Gruta. Svedana in Dola Yantra and Barjana with Gruta. Okay. So in olden days, you know about Jayapala in village side is called as Japala. It's a very common toxin during olden days. Japala, Japal Matra. You may be heard about this Jayapala. So that will going to induce chronic diarrhea. It will going to induce a diarrhea, instant acute diarrhea. Okay, so after consumption of one or two seeds of Jayapala, they will going for a loose stool for 10 to 12 times. Such a strong drug. So usually in olden days, toxication will be there with Jayapala. Somebody will mix Jayapala to the food. Or else in olden days, they are using a copper vessels. So copper vessel toxicity was also there. So what was the common traditional practice in olden days is, so if you observe a senior persons in the home, like grandmother or the grandma, grandfather, if you're going for a communal functions, group functions, they will advise to hold some ela in the mouth till the completion of food. If you are going for a marriage functions or any other functions for consumption of food, if the food is making in that area particularly, they advise to keep one ela in the mouth. Okay, the ela is an antidote for Jayapala. If you keep ela in the mouth, if you consume Jayapala also, it won't work. They will give antidote while going for a function. This is a very common practice in olden days. So some intoxication will be happen. Okay, so for that reason only they are giving an antidote before going there. Ela. Ela is such a good drug. Elaki. Okay, and even in some practices, lavanga is also used. Lavanga is also an antidote for copper and as well as Jayapala. So the practice of betel leaf chewing after food is to detoxify any toxins inside the food. So jati, lavanga, kankola, katakai. So you know about the shloka of this one, tambula. Okay, it contains jati, lavanga, kankola, kataka. So all these ingredients. So out of that, ela is a natural antidote. Okay, lavanga is a natural antidote. So both will be consumed. So ನೀವೇನಾದ್ರು ಪಾನ್ purchase ಮಾಡಿದ್ರೆ in the pan definitely will get ela and as well as lavanga both. So that is the traditional practice in olden days. After food, they used to consume betel leaves. Okay, so every traditional practice having some scientific reasons behind it. So nowadays nobody will consume it. Even some garavisha or dushivisha present in the body will naturally will get detoxifies. Okay, even unknowingly some intoxication will come in food. It will also get detoxifies. So Usually, if you consume food in functions in hotels somewhere else, better to consume pan. Okay. Now onwards to safeguard yourself from toxicity because they won't maintain hygiene. The hotels, the tables, everything will be very good looking, hygienic, but we don't know the kitchen and we don't know how they will going to make it out and what type of food they will like, whether they will wash it or not wash it, in which water they will going to wash. We don't know. So for our safety, better we can consume LR, lavanga after consumption of food. Okay, make it as your practice. Next, Jayapala, Ela Churna and Dadi Aitalva Jayapala Aitala. Okay. Next is Datura. Datura. It's called as street poison. In the olden days, it's very common everywhere in the streets. So in North India, ಆ ಕಡೆ ಎಲ್ಲ ಇದನ್ನ ಉಚ್ಚಿ ಗಿಡ ಅಂತಾನೆ ಕರೀತಾರೆ. After consumption of the seeds of datura, they will act like an intoxicated, like a mad person. So that's why it's called as an uchi gira, mad tree. In traditional common names, it's called as uchi gira. So it's in English, it's called as thorn apple. Thorn apple, English name, datura. So antidote is godugdha and sharkara or samudra falaka. Samudra falafalaka or godugdha and sharkara. So purification is Svedana with godugdha. Svedana and Dola Yantra with godugdha. Svedana and Dola Yantra in godugdha. Next one is Gunja. Same antidote is same, godugdha and sharkara for Gunja also. Antidote is godugdha and sharkara. Svedana and Dola Yantra in Kanji or godugdha. Gunja Mula is actually an antidote for snake poison. Gunja Mula. So because the concept is very clear, Stavara Visha is an antidote for Jangamisha and Jangamisha is an antidote for Stavara Visha. Okay, in that concept, so we're using Gunja Mula as an antidote for snake poison. Okay, so the antidote of Gunja is Godugdha and Sharkara, same, and Svedana and Dola Yantra Svedana in Kanji are Godugdha. But Gunja is used in many what we can call is Mata Mantra, black magic. Gunja. So there are very many varieties of gunja, white one and red one, black one. Okay, they are using a white and black varieties of gunja in black magic. It has the power of poison. Okay. Next, bang. So antidote is takrapana and tandalodaka. So bang antidote is takrapana and tandalodaka. So ಬಾಂಗಿಗೆ ಭರ್ಜನ ವಿತ್ ಗೋಘೃತ ಕೂಡ ಇದೆ, ಭಾವನ ವಿತ್ ಗೋಘೃತ ಕೂಡ ಇದೆ. Both we can do for bang. ಚಕ್ರಪಾನ ತಂಡಲೋದಕ, ಭಾವನ with ಗೋದಗ್ಧ, and Gruta Bharjana can also done for a bang. In Karnataka, this area in South India, it is banned taking a bang. They will consider as a narcotic drug, but in North India, Bihar, Uttar Pradesh, Rajasthan, it is almost a common drug. They will use regularly, just like a pan. They will take bang. So in Kashi and Varanasi, you will get it easily in pan shop. Bang. So they will give bang as a Shiva Prasada also. And some agoris they are using regularly. Some Rishi Munis they are using this bang regularly for Indriya Nigraha. Okay, they are using bang for Indriya Nigraha. And bang will act as a neuro rejuvenator. Okay, so neuroprotector, neuro rejuvenator action can be expected from bang. Okay, it's a very good drug. Bang. And what is the specialty of bang is we were in the same mood when we were there in during the consumption of bang. For example, if you consume bang while logging, so till 45 minutes or 1 hour, you will be logging only. Till the effect ends, you will be logging only. If you consume bang while crying, you will be crying for another 1 hour or 2 hours continuously. If you take bang while sleeping, you will be sleeping for 1 day or 2 days continuously. So this will maintain the mood set. That is a special effect of bang. Okay. So when we are in North India trip, my friend taken bang. So while he is logging, so continuously for 45 minutes he is logging only. Just touch only will log. So one more guy take bang while sleeping. He slept for 3 days continuously. So he will wake up and he will see everybody. Again he will go to sleep. No food, nothing. 3 days he will slept only. So the antidote is takrapan. So that's why after consumption of bang, they will give you lassi. So pan shop and lassi shop will be adjacent only. They will give pan, immediately they will give lassi to nullify the effect of bang. If you get a chance, you can test it out in Kashi, Varanasi, in Neil. These places you will get easily will get. And in many areas, they are given bang as a bhavana in many recipes. Rasa preparations, bang is there. One of the drug is available, Trilokya, Trilokya Chintamani tablet is available. So Imp Street is a one company. They are marketing this drug. It contains 78 milligrams of bang in it. It's available. So they are claiming that this medicine will work in all types of neurological pain, spasm, especially dysmenorrhea. So menstrual cramps. Just by consumption of one tablet, cramps will come down. So all cramps will come down. And cervical spondylosis, lumbar spondylosis, sciatica, renal colic, renal calculi. So in all these cholecystitis, in all these cases, this Trilokya Chintamani will work. So it's available. So with your registration certificate, they will send you the drugs to your clinic only. This one, Trilokya Chintamani. And one more Maharshi company, they made Ayur Nidra as a tablet that will going to induce the sleep. It's also contain a bang as one of the ingredient. Ayur Nidra, Maharshi company. So these two medicines available with bang as one of the ingredient. Okay. Next is Arka Kshira. Bhavana Dravya is Gogruta. Sorry, antidote for Arka Kshira is Gogruta. Antidote for Arka Kshira is Gogruta. Chinchapatra Swarasa Bhavana. Bhavana is Chinchapatra Swarasa. Arka Kshira, Bhavana Dravya is Gogruta. Sorry, antidote is Gogruta. Bhavana is with Chinchapatra Swarasa. Snowy is also same antidote and same Bhavana. Arkakshira, when it fall to the eyes, it act as a poison. So many times those who are born and brought up in the village, you may exposed to this type of poisoning. Arkakshira and as well as ಸ್ನೂಹಿ ಕಳ್ಳಿ ಬರ್ತಾ ಇತ್ತು ಹಳ್ಳಿ ಕಡೆಯಲ್ಲೆಲ್ಲ. ಸೊ ಏನೋ ಮಾಡಕ್ ಹೋಗಿ ಟಕ್ ನಂಗೆ ಕಣ್ಣಿಗೆ ಬಿದ್ದ್ಬಿಡ್ತಿತ್ತು. So it will fall to the eyes and whole day you will be suffering. So a lot of paining and all these things will be there. But during that time, an antidote, what we have seen from folklore is Tulsi Bija. So one of my grandma, so they will keep Tulsi Bija directly to the eye. Within a minute, the whole Arkakshira will come to one point, it will come out. So we used to suffer from many hours, from morning to evening, just by putting a Tulsi Bija over the eyes. So it will take all Arkakshira one side and it will come out. By washing also it won't go. By putting some eye drops also it won't go. Just putting a Tulsi Bija over the eyes, it will come one side and full go. So just remember, so accidentally if you are exposed with Arkakshira, Snowy Shira, any types of these Kshiras, so Tulsi Bija is an antidote. Just put some Tulsi Bija over the eyes. So within no second, your pain will go. Redness will go. You will be all right. Okay. So what we people are practicing is only 1% of Ayurveda. Remaining 99% will be there in folklore. So single medicine can be work in many diseases and many medicines work in single diseases. So it's all yukti. So you can apply yukti to everywhere. We should learn everything from Prakriti, everything from everywhere, everybody. It's not a simple one, it's not a big one. So Charaka told in Charaka Siddhisthana, same thing. Okay. So the wise person will accept entire universe as its guru. Okay, wise will accept entire universe as its guru, and unwise will find the enemy in it. ಓಕೆ ಸೊ ತುಂಬಾ ಬುದ್ಧಿವಂತರು ನಾವು ಇಡೀ ಯೂನಿವರ್ಸ್ ನ ಗುರು ಅಂತ ತಿಳ್ಕೊಂತೀವಿ. ಸೊ ಎನಿ ಕಾರ್ನರ್ ಯಾವುದೇ ಒಂದು ಒಳ್ಳೇದು ಬಂದ್ರು ವಿ ಹ್ಯಾವ್ ಟು ಅಕ್ಸೆಪ್ಟ್, ಮೇ ಬಿ ಸ್ಮಾಲರ್ ಒನ್ ಆರ್ ಎ ಬಿಗ್ಗರ್ ಒನ್. ಬಟ್ ಅದೇ ಅನ್ವಯಿಸಿದ್ದವರು, ಸೊ ಬುದ್ಧಿ ಸ್ವಲ್ಪ ಯೋಚನೆ ಮಾಡದೇ ಇದ್ದವರು, ಸೊ ಎಲ್ಲದ ಕಡೆನೂ ಹುಡುಕ್ತಾರೆ ಅಂತ ಹೇಳ್ತೀವಲ್ಲ, ಇನ್ ಕನ್ನಡ ಯು ಕ್ಯಾನ್ ಕಾಲ್ ಇಟ್ ಆಸ್ ಹುಳುಕು. ಸೊ ಯು ವಿಲ್ ಫೈಂಡ್ ಎನಿಮಿ ಇನ್ ಎವ್ರಿವೇರ್. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ಕರವೀರ. ನವನೀತ ಇಸ್ ಅನ್ ಆಂಟಿಡೋಟ್ ಫಾರ್ ಕರವೀರ. Navanita is an antidote. Svedana with Godugda. Langali is also same. Karavira and Langali both same. But in Langali, we need to keep it in Gomutra for Shodhana. We need to keep it for Gomutra. Gomutra, Shodhana. Ballataka. Meghanada Swarasa and Vibhitaki is an antidote. But for Ballataka, Meghanada Swarasa and Vibhitaki is an antidote. So Shodhana with Ishtika Churna Garshana. Shodhana with Ishtika Churna Garshana. Okay, this is about Ballataka and some of the main Vishadravyas and their purification. So in the beginning only I told you, so we need to practice faster. You want a quick results in Ayurveda, we need to utilize Vishas and Rasas. These are also some of the herbal medicines we are used in our regular day-to-day practice. Okay, so why I'm stressing all those things means, so we are using Sanjeevanivati regularly, we are using Trigona Kirti regularly, we are using Mubhatyunjaya Rasa regularly. If you face some toxicity in the patient, so at that time, what are the antidotes we can give? And if how we can purify those visha in the body, inside and outside. So these things you must know. Okay, these things must be there in your tongue, tip of the tongue, everywhere. If you are a practitioner, you must know all these things. How to nullify the toxins. So in Twitter, from last 2 days, one war is going on against Sadhguru followers. In Siddha medicine, one lead toxicity was reported from the patient. They're having severe constipation, abdominal cramps. So by taking lead-based medicine from Sadhguru follower, Siddha Vaidya, Siddha Vaidya, Siddha system of medicine Vaidya. Not Swasiddha, it's Siddha Vaidya. So these things will happen everywhere. So if the drug is not purified properly, if the lead is not purified properly, if the mercury is not purified properly, if they're given overdose of those medicines, these things will be very common. Lead toxicity is there, but we need to think about the issue. So before advising to the patients, we need to check the toxicity, lead toxicity. Nowadays, lead will be there in every vegetable. Those vegetables will be grown in polluted water. You know, the sewage water will go to polar area. The Bangalore sewage water will get purified. It will be circulated for agriculture purpose. Am I knowing about it? Don't know. Yes. Not only in Bangalore, every city, the Mori water will be purified and it will be circulated for agricultural purpose. The toxicity will come. So lot of industries are situated in Bangalore. They will give some toxicity. Then same toxins will be there in the food, and same food will consume. That same poison will enter into our body. And those industries will be there in the river banks. They will throw the waste to the river. Okay. So I checked one patient is complained about the patient consumed only 1 month of the medicines and they complained about lead toxicity. They accidentally done a complete body checkup and that lead is increased. So they're consumed only 1 month of medicine. It's completely herbal medicines. What I have given the medicine is completely herbal medicine. Then I have sent that medicine for laboratory to check the lead percentage. They are telling it is in the normal lead level, 7.8%. It is very common nowadays. 1% to 8% lead will be there in the herbs. So and vegetables also it's very common. Regular consumption of those vegetables, those milk items. So definitely it will be toxicated. It's very common. So antidotes are there for lead toxicity. We can use those antidotes and we can nullify the things. Okay. So remaining things will continue next class. So from now onwards, your thinking ability towards Agatantra should be different. So we can think in different way, in different manner about using of agada medicines in a proper way. Visham pranaram echa yukta yukte rasayani. How to purify it properly, what dose we can use. All those things we should monitor. Okay, Vishadravyas we should monitor. Okay, we'll continue tomorrow. So tomorrow from morning, I will message you the timing. So just go through Agada Tantra notes, whatever you have, and just come for one test. Some simple test we will give you. Then I will continue with Agada class. Okay. Shall I end the class?